Next is about udara. अथातः उदराणां चिकित्सां व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः। अष्टौ उदराणि पूर्वमुद्दिष्टानि तेषु असाध्यं बद्धहुतं परिस्राव्य च अवशिष्टानि कृच्छसाध्यानि सर्वाण्येव प्रत्याख्ये उपक्रमेत. Among the Ashta Udara, the Baddha Udara and Parisravya Udara are considered as asadhya. The others are kricha sadhya. But in all the other conditions, because the prognosis is unpredictable, it's considered as the pratyakshaya. Teshu adhyah chaturvargah bhesha sadhyah उत्तरः शस्त्रसाध्यः कालप्रकाशात् सर्वाण्येव शस्त्रसाध्यानि वर्तयितव्यानि च. The first four, that's Vata, Pitta, Jakapaja, are the can be managed with the medicine, or Dushudara also can be managed with the medicine. Whereas Uttara Shastra Sadhya, that's a Parisravudara and Baddhagudara are to be treated with the surgical treatment only. And Kala Prakashadu Sarvanyam Shastra Sadhyani, in due course of time, if they are not treated at proper time, they can become incurable and they need to be treated surgically. In general, in all cases of Udara Vyadhi, Udaritu Guru Abhishandi Ruksha Vidahi Snigdha Pishida Parisheka Avagahan Parihareta Shali Sastika Yavagodhu Manivara Nityam Ashniyat. In all the patients who have the abdominal complaints, a general guideline for the diet would be anything which is Guru heavy for the digestion, and Abhishandi which produces moisture, which increases the moisture of the body, or anything which is absolutely dry like a junk food, or which produces burning, or which is not easily digested properly, or extremely oily substances, non-vegetarian food have to be avoided. Similarly, taking bath in water or too much of contact with the water with the body also have to be avoided. Whereas easily digestible food like Shashikashali, Yava, Godhum and Yamara, which have low calorie intake and easily digestible food have to be preferred for all kinds of udara. So the first of the foremost in case of udara vyadhi is about the treatment, this diet and lifestyle. तत्र वातोदरणं विदारिगन्धादिसिद्धेन सर्पशा स्नेहयित्वा तिल्वकल्पक्वेन अनुलोम्य चित्रापरतैलप्रगाढेन विदारिगन्धादिकषायेन आस्थापयेद अनुवासेच्च साल्गुणेन च उपनाह्येत् उदरं भोजयेच्चयनं विदारिगन्धादिसिद्धेन क्षीरेण जानरसेन च स्वेदयेच्च अभीक्षणम्. Vata Udara is characteristically the typical presentation of a colicky pain. Patients who have extremely severe colicky pain in the abdomen. And when we say the colicky pain, the source of the colicky pain could be anything, like it's not a single pathology. Multiple lesions can produce a colic pain, like, and depending upon the type of the pain, like what Sushila has said, Sangrishya Parshodara Pushanabhihi Advartate Krishna Siravanadam Sashulam. But when we assess the pain in a patient of pain in abdomen, it could be based upon abrupt onset and very severe pain. Could be due to myocardial pathology, biliary colic, urinary colic, perforated ulcers, or a aneurysm which has become rupture. Or there could be a rapid onset and severe consistent pain, constant pain, continuously severe constant pain, suddenly occurring, like as in case of acute pancreatitis or mesenteric thrombosis, or even ectopic pregnancy-like conditions. A gradual and steady pain which is continuously increasing could be seen in cholecystitis or hepatitis, occasionally appendicitis also, or diverticulitis-like conditions. Intermittent episodes of pain could occur due to early pancreatitis or maybe small bowel obstructions. Now, hence the protocol of the treatment cannot be uniform. But there is one aspect of it. The other aspect is about the management of the pain, the symptomatic relief. For symptomatic relief of all these kinds of the pain, local application of heart fermentation or maybe a certain anti-spasmodic drugs are the usual choice of the treatment, which reduce the spasm of the pain, and when of course you have the analysis. And whatever Sushila has said, like the Vidarigandha Siddha Grisapana or Anulomana or the Anuvasana or Upanahana, application of the hot substance over the area, or giving easily digestible diet and Swedana fermentation over the area could be the choice of the treatment. I would consider this as a symptomatic treatment. In the present day's clinical situation, I would always prefer Agnitundi, Nabhivati or Jirakadyarista as the base treatment. Of course, a confirmation of the diagnosis is based upon the location of the pain, like if it is in right hypochondrium, it could be due to, usually, this kind of equation is not very rigid. It's about the general perception. If the pain is located in the right side, it could be either due to the gallstones if it is in the upper segment, or it's in the middle segment, lumbar area, it could be related to the urinary system, or it could be even due to the lumbar hernia. In the lower quadrant, it's appendicitis, or even the other pelvic pain, inguinal hernia-like conditions. Similarly, on the left side, again gastric ulcers or biliary colic also can occasionally be referred to the left side occasionally, and again left middle segment, kidney stones, or in the left lower segment, pelvic pain due to the other pathologies, pelvic conditions, diverticulitis. And similarly, in the central abdomen, it could be the heartburn or this burn as a gastroesophageal reflux disorder. Even cardiac pain may be referred to the epigastric area. Central abdominal pain, early appendicitis, pancreatitis. Lower this hypogastric area, it's about the pelvic pathologies or bladder pathologies. Now, in all these conditions, though the ultimate treatment would be varying based upon the diagnosis, as a first step to reduce the pain, I would prefer Agnitundi, Nabhivati, Jirakadyarista. I don't mean to say that with this you can treat every disease of that sort. Each of these diseases need to be analyzed and their protocol of the treatment has to be followed. So, as a symptomatic relief in all the patients with acute pain, this can be given temporarily for measure, but the ultimate diagnosis is necessary. Similarly, Pittodaya, in Pittodyanam, Madhuragana Vipakvena Sarpishasnehekla, Shama Tripala Trivadvipakvena Anlomya, Sharkara Madhugusta Pragadena Negrodhad Kashayan Asaped Anvasecha, Payasen Upanahet Udaram, Bhujete Enam Vidari Gandhadis Dena Payasa. In case of inflammatory pathologies of the abdomen, or very particularly of the hepatic pathologies, either it's a hepatic pathology or inflammatory pathologies of the abdomen, in these conditions, the treatment would be Madhuragana Vipakvasarpihi, Grita, or Anulomana with the Shama, Trivit, etc., or the Anuvasana, or application of Payasa over the abdomen. Now, this is not really practiced. The application of Payasa is not really practiced in the regular practice, but it's something like moderately cooled substances which are applied over. Now, cold packs are given. In case of inflammatory pathologies, cold packs are better. Spasmodic colicky conditions, hot packs are better. These issues we have discussed in the udarachikitsa as such. In the Nidana again, we have referred to these issues somewhat to an extent. Now, in all such inflammatory conditions, which may be related to liver or otherwise, my preference would be as a symptomatic relief, Mrityunjaya Aragyardhini Kumaryasana. Of course, the final diagnosis and final treatment again in these conditions would be varying depending upon the condition, which needs evaluation, clinical evaluation, and the exact diagnosis is necessary, and the treatment protocol also would be varying accordingly. Many of these conditions may require surgical treatment, or if the inflammatory pathology has gone beyond a limit of certain limits like physiological limits, then we may need to have supportive treatment with antibiotics, etc. So when I say Aragyardhini Mrityunjaya as the first line of the treatment, I don't mean to say that every condition can be treated as such. Similarly, Shleshmodarinam, in the Shleshmodara, the typical presentation of this treatment protocol would be Pippaladi Kashaya Siddhyana Sarpishasnehya, Snuhi Kshirvipakvena Anlomya, Trikatuka Mutra Ksharataila Pragadena Mushkakadi Kashaya Rasaped Anvasecha, Chana Atasi Dhataki Kimna Sarshapa Mulaka Bijakalkishta Upanahet Udaram, Buje Chenam Trikatuka Pragadena Kulatha Vishara Paiseta, Swedecha Bikshanam. This Rashmodara, typically the patient would have a Shitalam Shukla Sidavanandam, Guru Stiram Shukla Khananasya, Snigdam Mahatshopitam Sasadam Kafodaram Tatuchirabhivati. When you have a palpable mass in the abdomen, which is somewhat firm or rigid, and which is comparatively less tender, which is often produced due to the distension of an organ or neoplastic lesion somewhere, as in case of hepatoma, that tumors of the liver, or maybe benign or malignant the other way, or it could be the foreign bodies in the stomach, it could be the splenomegaly, it could be the obstruction of, or maybe the swellings of the lymph nodes, etc., or it could be axis, appendicular axis, or it could be mesenteric cyst as such, or it could be ovarian pathologies, masses as such. So the conditions which can present with a mass in the abdomen could be quite sure, or in the posterior abdomen it could be the renal masses like. So all in all these conditions, it's quite important, and you cannot avoid those steps of the diagnosis protocol. You need to go for the diagnosis, and the treatment would be based upon the exact diagnosis. There again, as a symptomatically, to reduce the pain temporarily till you have made the diagnosis or till you have selected the correct line of the treatment, could be Tripuragulu, Chitrakartivati, Avivitigalachurna, something on the same lines as what Sushra has suggested, though the Snehana and Dhanavasana may be quite laborious. So, I would consider these steps as only the first steps in the management till you have made the diagnosis. But the later treatment protocol would be based upon the final diagnosis only. दुष्योदरणं तु प्रत्याख्याय सप्तला शङ्किनी स्वरसिद्धेन सर्पिषा विरचयेत मासम् अर्थमासम् महावृक्षक्षीरसुरा गोमूत्रसिद्धेन शुद्धकोष्ठं तु मध्येन अश्वमारकगुञ्जा काकादनीं मूलकृतं पायेत इक्षुकाण्डानि वा कृष्णसर्पेण दंशयित्वा भक्षयेत् वल्लीफलानि मूलदिं कन्दजं वा विषं वा सेवेत् तेन अगदो भवति अन्यं वा भावं नापद्यते. Dushogara is where there is a cumulative toxicity and very chronic abdominal pathology, and we have referred to that issue in the Nidana, discussed that part, so I will not waste much time. And it's a condition where you do not have any chances of surgical intervention. Chronic pathologies like sprue or maybe colitis, all such conditions, chronic colitis, varieties, all that varieties, or maybe the diseases like ulcerative colitis, these are can be considered as Dushogara Lakshanas. And in such or any toxic pathologies, patients who have consumed toxic substances, it's a purely medical condition. And there again, the treatment would be based upon the actual diagnosis. But in general, we can reduce that toxicity by administering the drugs like Anand Bhairavi, Mustakarisha, etc., which is a common treatment. But what Sushruta has suggested is a very rigorous treatment. One of the rigorous treatment is a Virechana with very strong purgatives like Saptala Shankhini Swarasa, which are very strong purgatives. They have to be given for prolonged duration. Virechana for Masam, Arthamasam, for a month or 15 days. Not a single day is Virechana. Unlike that of the Virechana where you go for the protocol of Snehana, Svedana, etc., in these conditions, a strong purgatives could be given. One of the exceptions to the word Virechana. See, whenever we do use the word Virechana, it means a comprehensive protocol of Pura Karma, Pradhana Karma, Paschat Karma. But in case of this Udara, a Virechana can be given without this protocol also, and it should be very strong purgative, given for a long duration like 15 days or 1 month or so on, depending upon patient's condition. But this should not be misunderstood as an Nitya Virechana. So that's not the point, right? Okay, that's the controversial issue. I will not go into that controversy. Or the choices of the drugs could be of other like Gomutra, Sura, etc., or Ashwamaraka, these Gunja Kakavani, Vishadravyas, poisonous substances could be given. And another very unique treatment suggested by Sushruta is a Krishna Sarpavisha, which is given after making the snake bite the sugarcane stem and then that has beaten. Of course, this looks very complex like issue. Practically, I don't have any experience, I will not comment on that part, like whether it is true or not. But very strong, severe purgatives are given in such conditions. Many times it could be a toxic substance to neutralize the toxicity. Then Kupitanila Mulatad Sanjita Tomalasija Sarosari Bahushistu Anuloman. The general line of the treatment in all cases of the Udara is Anulomana. And this is because basically there is always a vitiated pathology of Vata, and there is a accumulation of the mala. Then the other yogas, athavardam samanya yogan vakshamaha. The other yogas which could be preferred are Eranda Tailam Aharaha Masam Do Kevalam Mutritam Shiritam Sevetam Udakvarji. Eranda Taila again a strong purgative given for a long duration every day for a month or 2 months with Gomutra or Kshira, and patient should not consume water during that period. Very strong purgative treatment. Maheshama Mutram Kshirena Nirahara Satratram Mahesha Kshira. This buffalo's milk given for a week or so without any other food, it's only that. Or Ustri Kshirahara Vanna Parivarji Paksham, camel's milk given for a long duration. Pippali Masam Puruktena Vidhanena Seveta, or Pippali also in the Pippali Bardhamana Pippali Yoga given as a very long duration. Or sign of Adamoda Nikumbatela with the sign of Adamoda. Ardra Shungavera Sapata Shata Siddhama Batashula Avajari Shungavera Shunti Rasa again given in a large quantity as such. Then Shungavera Rasa Vipakum Kshiramatsaveta Shunti Kshirapaga could be given. Chavya Shungavera Kalkama Paisa Sarala Devadar Chitragama Yavaba, another of the yoga. Murungi Shanaparni Shama Punarnama Kalkamba, Jyotishka Palatilamma Kshirena Swarjika Hindu Mishram Pibeta. All of these are very strong purgatives or very potent medicines, like irritant medicines, which can produce the irritation of the stomach, gastrointestinal tract. Gudaditiya Haritakim Bhakshayatam. Buddha Haritaki is another of the yoga which can be given. Of course, this is something practicable which can be tried in patients practically. The other yogas are very complex yogas. Snuhikshira Bhavidanam or Pipalinam Sahasram Kalena. 1000 Pipalis with the Snuhikshira in the Vardhamana Pipali Yoga. Tathya Krishna Churnama Snuhikshira Bhavidam Utkarikam Pakvam Abdapayata. These are all the different yogas which were tried by Sushruta. Practically in these days, to try this would be, may not be very practicable. Haritaki Churnam Prastham Adake Gisrasya Avapya, Angareshu Abhivilapya, Khajena Abhimatya, Anukupam Krutva Ardhamasam Yavaparlevaseta, Tadascha Udritya, Parisrabya, Haritaki Kwata Amla Dathini Avapya. Vipajeta, Tadyatha Yogam Masam Ardhamasam Apayeta, Gabye Payasi, Mahavrikshiram Avapya Vipajeta, Vipakvam Chavatarya, Shiti Bhutam Manthanena, Abhimatya, Navanita Madaya, Bhuyo Mahavrikshiram Vipajeta, Tadyatha Yogam Masam Masardhamma Payeta. Another very complex method of preparation of the medicine. The Haritaki Churna with the Ghrita has to be heated, and this has to be kept in fermentation, and once it has become fermented, the liquid component has to be separated, the sediments have to be separated, and again it has to be processed with the Haritaki Kwata and curd. And from this, it can be given orally, or another is with the cow's milk, this Mahavrakshakshira, that's Snuhikshira is added, and then the butter is extracted, and from the butter ghee is prepared, and that ghee is given. So these are very complex methods of preparation of the medicine. Chavya Chitraka Danti, Ativisha, Kushtha Sariva, Tripala, Adimoda, Haridra, Shanchini, Trivrta, Trikatukanam, Ardhakashkaha Bhagaha, Radhavikshapalamajnam, Astaukarshaha, Mahavikshakshirapale Dve, Gavam Shiramutriyo, Astauvastani Parani, Etat Savam, Ghazapraste Samavapya. Vipajay Tatita Yoga Masamardham Masama, Tilvaka Grita Chatuthani, this Tilvaka Grita, another of the yoga, Chabeti Traga, etc. This is the usual Grita Yoga. Sarpim Shudari Gulma Vidradi Astila Anaha Kusta Ulmada Apasmare Shupayajani Virechnartham, Mutra Savarista Surasha Bhikshnam Mahavakshira Sambrata Seveta, Virechana Dravika Shayam Makshire, Shungavera Devadaru Pragadham, Virechana Dravyas have to be given, and either it could be Chiloka Grita or any other Grita which you can prepare as it. Vamana Virechana Shirovijana Dravyadam Palika Bhagaha, Pipadyadi Vachadi Haridrali Paripatitanam Dravyadam, Slakshnapistanam, Methoktanam, Lavanaam, Tatsavam Mutragane Prakshipya, Mahavrakshakshira Prastamcha, Mrutu Agnina Avaghatayana, Vipacheta, Pradakha Kalkam, Tat Sadhasiddham Avatarya, Shiti Bhutam Akshamatra Gutika Vartayeta. तासाम एकाम द्वौ तिस्रौ वा गुटिकाः बलापेक्षया मासान् त्रीन् चतुरो वा सेवेत एषा आनाहं वर्तिक्रिया विशेषेण महाव्याधिषु उपयुज्यते। कोष्ठजांशकृमी न वहन्ति। कासश्वासकृमि कुष्ठप्रतिशाय अरोचक अविपाक उदावर्तांश्च नाशयति। Another prayoga which can be given either orally or in the form of suppository. Of course, preparation with the Vamana village and Shiro village Gana Dravya or Haridradi Gana, Vachadi Gana, Pipadi Gana Dravyas are to be used, and with this salt is added, and then Mutra, different varieties of the urines of animals have to be added, and then Snuhi Kshira. Snuhi is considered one of the Agradravya in all cases of the Udaras. ಮದನಫಲ ಮಜ್ಜಾ ಕುಟಜ ಜೀಮೂತಕ ಇಕ್ಷ್ವಾಕು ಧಾಮಾರ್ಗವ ತ್ರಿವೃತ್ತ ಕಟುಕ ಸರ್ಷಫಲ ವಡಾನಿ ಮಹಾವೃಕ್ಷ ಕ್ಷೀರಮೂತ್ರಯೋ ಅನ್ಯತರೇಣ ಪೃಷ್ಟ್ವಾ ಅಂಗುಷ್ಠಮಾತ್ರಾಂ ವರ್ತಿಂ ಕೃತ್ವಾ ಉದರಿನಃ ಆನಾಹೇ ತೈಲಲವಣ ಅಭ್ಯರ್ಥ ಬುಧಸೆ ಏಕಾಂ ದ್ವೌ ತಿಸ್ರೌ ವಾ ಪಾಯೌ ನಿದಧ್ಯಾತ್ ಏಷ ಆನಾಹ ವರ್ತಿಕ್ರಿಯಾ ವಾತಮೂತ್ರಪುರೀಷ ಉದಾವರ್ತ ಆತ್ಮಾನ ಆನಾಹೇಷು ವಿಧೇಯ. Another suppository preparation which can be kept in the rectum. So suppository is given in the rectum is one of the protocols of treatment in case of intra-abdominal pathologies by Sushruta. Then Prihodarinaha, in the Prihodara, Snigdasvinasya Dadna Bhuktavatah, Vambahu Gulparabhyantarahat Siram Vidyeda, Vimardecha Panina, Prihanam, Rusirasandanatam, Talaha, Samshuddhadeham, Samdrashuktika Ksharam Paisa Payeta, Hingu Sabartikeva Kshirena, Sudena Parashaksharena Yavaksharam, Kimshva Ksharodikena Bhushas Sudena Yavaksharam, पारिजातक ईश्वरक अपामार्ग क्षारम व तैल संस्कृतम शोभांजनक विषम पिप्पली सैंधव चित्रकयुक्तम पूतीकरण्य क्षारम व अम्लस्कृतम विड लवण पिप्पली प्रगाढ़म. Another protocol in case of splenomegaly conditions is a raktamokshana, where you will have to do the bloodletting by venesection of the cubital vein on the left side, the gurparabhyantara cubital vein on the left side, and then once the veins are opened, the spleen has to be compressed to make the blood flow out. Of course, we may not exactly do this kind of a treatment, but in case of splenectomy surgeries, once we open the abdomen, before we remove the spleen, the blood would be squeezed. The spleen has to be squeezed so that that collected blood in the spleen would enter into the system, and hence the net blood loss can be minimized. So squeezing of the spleen to make the blood move is a practical solution, but whether that can be really pushed up to the cubital vein or not, and then how far it would be affecting, these are all the questionable issues which we may not have a definite answer at this moment. Then the internal medicines could be again ksharas of different variety, samudrashukti kshara or himsavarchika etc., the other drugs which could be given, or some more of the Tikshna Dravyas which are given are again Pippali Mula Chabya Chitraka Shringavera Yabakshara Saidavanam Palikaha Bhagaha Vritaprastam Tattulyam Akshiram Tadekatyam Vipachayata Tat Shatpalakam Namasatbhi Shatpalaka Dhrita, which is available. That with that name the drug is available. Priha Agni Sanga Gulma Udara Udavarta Shvetu Panduroga Kasa Shwasa Pratishaya Urdhuvata Vishamajvarana Bhanti Mandagnerva Hingvadikam Chunam Upayinjita. These kinds of the treatment is suggested. Then the whole controversy is about the Ekradali Udara, hepatomegaly conditions. Again, these controversies and the possible different options we have discussed in the Nidana. So there is no definite answer to this question like what's Ekradali Udara as such. Ekradalyaapyeshah ekchakriya vibhagah visheshastu Dakshinabahau Siravedah Manibandham Sakrannamya Vamangusta Sametam Dahet Siram Sharenashu Likhno Vedya Prashantiye. The Ekradalidara Raktamokshana is suggested, but when you do the Raktamokshana, it should be on the right cubital vein, not on the left side, unlike that of the splenic condition. Then in the splenic condition, a Sira Dahana also is correct, suggested. Agnikarma over the Sira cubital vein, and or maybe a vein which is very close to the left thumb as such, near the wrist joint. In the wrist joint, not the cubital, it's the wrist joint. A vessel is cauterized, which is suggested as a treatment of splenomegaly. Question mark, of course, whether this is really practicable or not. Then the next is about the surgical treatment in case of the surgical conditions. And the surgical conditions like Baddhaguda, that's obstruction, or Paristravani, perforation conditions. laparotomy is suggested. Protocol of laparotomy mentioned by Sushruta is absolutely the same as we do now. The only difference goes in the details. Now, those protocol of preparing our patients for this laparotomy is स्निग्धस्त्रीणस्य अभ्यक्तस्य अधोनाभेः वामतः चतुरङ्गमपहाय रोमराज्याः उदरं पाठयित्वा चतुरङ्गुलप्रमाणम् अन्त्राणि निष्कृष्य निरीक्ष्य बद्धकुदस्य अन्तःप्रतिरोधकरम् अश्मानं बालं वा अपोह्य मलजातं वा ततो मधुसर्पिभ्याम् अभ्यद्य अन्त्राणि यथास्थानं स्थापयित्वा बाह्यं व्रणम् उदरस्य सीवेत्. Preferred incision is lower abdominal incision, paraumbilical incisions, like not the midline, on the sides, either left or the right side is preferred. Now this again is very scientific. If a midline, median incision is done, you will be going through the ligamentous structures, and that the ligaments won't heal easily. Whereas if you go through the rectus muscles and the rectus sheaths are covered, the wound will have a better elastic strength, and this is exactly what Sushila has suggested by preparing a paramedial incision. So lower abdominal paramedial incision is preferred for laparotomy, and even now whenever there is a need for exploratory laparotomy, it's always a paramedial incision is preferred than the midline. Now, then once you have opened the abdomen, you will have to identify the location of the obstruction, and that obstructed lumen has to be cleared either by squeezing or by making a just opening, and then the hole has to be evacuated out. So that's exactly the same protocol now. In case of intestinal obstruction, the same is done. The proximal loop which is distended has to be clear. Either it could be done by a puncturing and then draining all the contents out, or it could be pushed back depending upon the quantum there. And then you have to close that aperture, that opening in the abdomen has these intestines have to be closed, and then the abdomen has to be closed, suture layer by layer. Parishravanya, in case of perforation too, similar treatment is done where the perforation has already occurred. There, along with that, you will have to do the lavage, peritoneal lavage. Shalyam mudritya, antrasravan samshodhya. So, peritoneal lavage has to be done. Then tachidram antram samadhaya kalapipilikaभिः दंशयेत् दष्टे च तासां कायान् अपहरेत् न शिरांसि ततः पूर्ववत् सीवेत् सन्धानं च यथोक्तं कारयेत्. Now, in case of perforated intestines, after opening the abdomen, laparotomy is important. This lavage, gastric lavage is important. Peritoneal lavage is important. The whole peritoneal cavity has to be washed out, cleared, and then the perforated area has to be sealed. And to seal that, it's always preferred to have absorbable sutures. And Sushruta had prepared absorbable sutures in the form of ants. The ants will be made to bite that area, so that that biting would close the aperture. Then the body of the ants are cut off. Only the head portion is left out, so that the chitin, these pricking structures of the ants, they would be acting as a absorbable suture. So one of the major milestones in the development of the suture material or use of a animal product for the suturing material is one of the important milestones as such, and this is a very unique concept. Though it may not be very practicable now, I don't say that you have to bring ants and then use again same, because now you have better options of absorbable sutures from animal origin. So anyway, this is what Sushruta has suggested, and it's usually highlighted as one of the major achievements of Sushruta in the course of development of different technologies to use in the wound healing. Then after that, the states Lachankayam Shiramsi, the Purot, then the abdomen has to be closed. Sandhanam Chetoktam Karayet, Yasti Mutukumishaya, Krishnamda Avalipya, Bandhe no Pacharetam. The abdomen has to be closed with a thick binding, thick bandage. Wound has to be closed with, and for that you may use a cloth which is having impregnated with the black soil, which is rigid, something like a plaster of Paris bandage, like rigid bandage is used. Tato nimatam agaram pravesh acharikam pradesha vase chenam taila dronyam sarpit dronyam va payovrittimiti. To prevent the sepsis, Sushruta has suggested to keep the patient dipped in a boat-like structure containing oil or maybe ghee. Now, fat or oil or ghee would prevent the infections, though it may not be very practicable or reproducible method now, because you have different better methods of treating the patients which is more comfortable. Dakodara, so in case of Udakodara or ascites conditions, the draining of the udara, paracentesis protocol, again very detailed protocol is given by Sushruta, and that protocol of paracentesis, draining of or aspiration of the fluid from the abdomen would be Batahara Taila Abhektasya Ushnodakaswinnasya स्थितस्य आप्तैः सुपरिगृहीतस्य आकक्षातपरिवेष्टितस्य अधोनापेः वामतः चतुरङ्गुलम् अपहाय रोमराज्याः व्रीहिमुखेन अङ्गुष्ठोदरप्रमाणम् अवगाढं विद्येत तत्र त्रप्वादीनां मन्यतमस्य नाडीं द्विद्वारां पक्षनाडीं वा संयोज्य दोषोदकम् अवसिज्येत ततो नाडीम् अपहृत्य तैललवणेन अभ्यद्य व्रणं बन्धेन उपचरेत न च एकस्मिन्नेव दिवसे सर्वं दोषोदकम् अपहरेत सहसा हि अपहृते तृष्णा ज्वर अंगमर्द अतिसार श्वासकाशपारदाः उत्पद्येरन् आपूर्यते वा वृषगरम् उदरम् असञ्जात प्राणस्य तस्मात् तृतीय चतुर्थ पंचम षष्ठ अष्टम दशम द्वादश षोडश रात्राणाम् अन्यतमम् अन्तरीकृत्य दोषोदकम् अल्पाल्पम् अवसिञ्चेत निःसृते च दोषे गाढतरम् आविक कौशेय चर्मणाम् अन्यतमेन परिवेष्टयेत् उदरम् तथा नाध्मापयति वायुः षण्मांसंश्च पयसा भुजेत् जाङ्गलरसेन वा ततः 3 मासान् अर्धोदकेन पयसा फलाम्लेन जाङ्गलरसेन वा अवशिष्टं मासत्रयम् अन्नं लघुहितं वा सेवेत एवं संवत्सरेण अगतौ भुक्ति. Now that whole protocol of aspiration or paracentesis of the abdominal fluid is discussed by Sushruta, and the method is the first is the patient has to be prepared with the abhyanga or swedana, and then Sushruta has suggested another one technique of increasing the abdominal pressure by covering the whole abdomen with the typical bandage, thick bandage, like any cloth, akakshan pariveshtitasya, that up to the level of this axilla, the whole area of the abdomen has to be compressed. A compression bandage has to be applied, and then the preferred site for the insertion of the trocar is over the left side of the midline, 4 angulas beyond the midline, and on the left iliac area, which is always more convenient. If you prick on the right side, there is a possibility of injuring the cecum, because cecum is a relatively fixed organ. On the left side, the colon has a mesentery and it can be moved freely, and hence the chances of your needle pricking the intestines or perforating the intestines is parallel less. I don't say never, but it's a parallel less. And then a trocar is introduced, trocar with the cannula is introduced, and the fluid is drained out. Now, when we do the drainage, this paracentesis, now we may not apply a bandage around the abdomen. A compression bandage around the abdomen may not be applied in routine conditions, but the indications for the aspiration is depending upon the patient's condition of pathology. Only in those conditions where you cannot have a complete recovery of the patients, where the whole pathology of formation of the fluid cannot be reversed, we prefer a paracentesis. Or it could be for the diagnosis purpose. When we go for the diagnosis purpose, the total quantity of the fluid aspirated is only whatever the quantity is needed. There need not be an excess fluid. But in the other conditions, like ascites produced due to hepatic pathologies, portal hypertension-like conditions, where the pathology cannot be reversed as such, it could be just a symptomatic treatment to relieve the patient of the respiratory distress. There the quantity has to be to the extent which is required to produce the comfort to the patient. And when it cannot be reversed, the fluid formation cannot be reversed, a complete drainage or total aspiration is of no use, because there will be again reaccumulation. And it's also true that if you remove the fluid completely and then sudden changes in the intra-abdominal pressure occur, if due to the complete removal, the refilling of the fluid would be faster. So it is better to have maintain that optimum pressure in the abdomen by partial drainage. Now this is exactly what is the concept of Sushruta. You have to go for the partial aspiration, never full aspiration. If you go for the full aspiration, there could be the complications, and what Sushruta has mentioned as the complications are Trishna, Jvara, Angamardhatisara, Shwasakasapanagraha, or it can be reaccumulated. There is either there could be sepsis or there could be a rapid reaccumulation of the fluid, or there could be a shift of the fluid from the system to the abdomen, which also can produce changes in the fluid and electrolyte constant constitution of the body as such, and hence rapid expulsion is not always suggested. And hence Sushruta suggests like the frequency of the fluid aspiration could be once in 3 days or 4 days, 5 days or 6, 8 days or even 10 days or 12, 16 or so on. So depending upon the patient's condition, the gap between the two episodes of paracentesis can be enhanced or reduced as such. Then after the procedure, to keep the abdominal pressure, you have to tie a bandage again, which is much more rigid than the earlier bandage, and this is to prevent the reaccumulation. Now, external compression, whether it really reduces the fluid formation or not is questionable, and as far as we know now, it doesn't make much change. That external compression may not produce or may not reduce the reaccumulation of fluid, but at least it can maintain the optimum peritoneal pressure, which gives somewhat comfort to the patient. And the patient has to be given a rigid diet, low calorie diet like milk for 6 months, and then for another 3 months ardhodakena payasa palamdena. So gradually the diet has to be brought back to the normal. भवति चात्र आस्थापने च विलेचने च पाने तथा आहार विधिक्रियेषु सर्वोदरेभ्यः कुशले प्रयोज्यं क्षीरं श्रुतं जाङ्गलजवरसो वा. In general, liquid diet and nourishing diet like kshira or mamsarasa soup, they are preferred in case of all udaras as general ideas. With this, we conclude the chapter. The Sushruta Samhita Chikitsasthane Udarachikitsa Nama Chaturdashodhyayah. If there are any questions, we will try to answer and then wind up. Alcohol addiction can be cured from any Ayurveda drugs by Ayurveda up to G2 esophageal varices or G3 varices. Now see, there are two important questions: whether alcohol addiction can be cured with Ayurveda drugs or not. From my point of view, addiction cannot be cured. Addiction is a psychological dependence, and the patient has to have a decision. Like if the patient is having decision about avoiding alcohol, definitely yes, alcohol addiction can be prevented. So it's more of counseling and conviction of the patient, which is important than any of the medicines. But when during the withdrawal of the alcohol, if the patient develops any of these clinical symptoms, that can be definitely managed. And usually I prefer Saraswarishta, Smithsagarasa for that depression or sleeplessness, or Kumariyasara if case the patient has a gastrointestinal tract abnormalities. These are preferred as a treatment for the symptoms produced due to alcohol withdrawal. I don't consider that as such. Then as far as the esophageal varices are concerned, the unpredictability of the esophageal varices producing bleeding is one of the most important issue, and that depends upon the status of the liver. If the cirrhotic changes in the liver are quite huge, then the esophageal varices can have a high chance of the bleeding. There is absolutely no treatment for the esophageal varices anywhere. The only question of that clipping of the esophageal varices or the injections, sclerotherapy, which is done in the contemporary science, would be to reduce the chances of bleeding. There is no question of a cure for the esophageal varices. So when a patient comes to me and when I treat the patients, I always have a reservation about the possible risk of immediate this bleeding, massive bleeding from the esophageal varices, which has to be patient has to be educated, and most of the times we can manage the patients without that kind of an episode for quite a long duration with our treatment like Arogya Kumarya. So this is what we usually prefer. But again, it's a very complex issue, like to predict when a patient or which of the patient would develop that bleeding is very unpredictable, and it is very difficult to decide like which of the patient requires clipping or not. So usually that choice is left to the patient. But I do is I give the choice to the patients as such. But most of the times, if the patient follows the diet and the medicine properly, episodes of such bleeding can be reduced. Then there is another question: in case of acute severe abdomen, will Vata Udara line of treatment give instant relief? No, I don't think that. I don't have an experience of treating acute abdominal pain with the or acute abdomen conditions with those protocols of the treatment as such. And as I have suggested, my preference would be like Agni Tundi as a initial symptomatic treatment, but later the protocol would be based upon the exact clinical diagnosis and from the point of view of the safety of the patient and interest of the patient in the whatever is available in the contemporary system, they need to be adopted. So I may prefer surgery if the patient requires surgery or so on. So that depends upon the exact diagnosis, and the whole diagnostic process which we follow, they are quite vital and they cannot be bypassed. The initial treatment, of course, like Agni can be given safely, whereas treating with the same kashayas or ghata, which has suggested by Sushara without making the diagnosis would be again not very relevant in the contemporary situation. But there are a few of the patients where the diagnosis is not possible. Patient may have a functional condition, may are diagnosed as functional pathologies, and the patient may have to continue to have the pain. And in such conditions, definitely where there is no definite clinical emergency, those treatments can be tried. Very rarely we get such patients, and in such patients I have tried these, and some of the patients have got relief. But to make a definite theory about that would be quite difficult. That would be a very brief answer for that question. Then Pitta Udara treatment given for alcohol addiction patients. No, it's not the alcohol addiction and then the treatment is different. Alcohol addiction and the treatment given in Sushruta is something like a alternative choice to the alcohol, which we will come to that later on in the later Madhya and udarachikitsa. We will come across that part. So, Pitta udarachikitsa and alcohol withdrawal treatment mentioned in Samhita is totally different. But as far as the treatment protocol which I follow in my clinical practice is, I don't suggest any treatment for the alcohol withdrawal, and I would prefer to treat the patient only when the patient has developed some symptoms produced with the withdrawal of the alcohol. That is the same answer which is repeated. Then analysis of paracentesis fluid may guide in the management of adopting procedures. Yeah, of course, diagnosis is one of the important target of paracentesis. So if the patient, if we have already made a clinical diagnosis, analysis of the fluid is of no importance as such. But when there is a doubtful diagnosis, definitely yes, paracentesis fluid is one of the important issues. The fluid could be accumulated due to various causes. It's not only cirrhosis which can produce the ascites. There could be malignant pathology, there could be inflammatory pathology like tuberculosis which can produce that, and hence a biochemical analysis or microscopic analysis of the fluid after drainage is a routine thing to make the diagnosis. But if you have already made the diagnosis, there is no need of repeating that process, right? So that's about maybe the answer to that question, right? So with that we will conclude. Okay, fine. We will conclude today. Thank you.